In this session, we will see the repair procedures are done on the salivary gland and ducts. So the CPT code series starts from 42500 to 42510. See, 42500 to 42510. All these are the repair procedures done on the salivary ducts or the glands. So first we will see 42500 and 42505. So this is the plastic repair of the salivary duct, which is also known as silodocoplasty. Silo is nothing but the salivary. Plasty is what? Repair of the salivary duct or the gland. So it is of two types. So based on the complexity, simple and complex, it is divided like this. Okay, simple and complicated. So first one is a primary or simple, and the second one is a secondary or complicated. When it is simple, we have to code 42500. When it is a complicated repair, so we have to code 42505. So why provider will do this repair of the salivary duct? Suppose there is an infection in the salivary gland. See, this is one of the salivary gland. Okay, parotid, submandibular. Okay, any one of this, there is an infection or a damaged gland. So to repair that, he will do this silodocoplasty. To treat that infection, the provider will do this silodocoplasty. So what provider will do in this procedure? See, this is the parotid gland, which is an infected gland. So to this parotid gland, there will be a parotid duct. So what provider will do to treat this infection in the gland? He will pass a tube into the duct which is attached to this gland. I am taking an example of a parotid gland. It is not that only for the parotid they will do this procedure. They can do for submandibular, sublingual also. So to the parotid gland, which is an infected one, to treat this, there is a duct which is attached to the parotid gland. So what they will do? The provider, he will pass a tube into this duct. See, this is the tube. So they will pass the tube into this duct, and until the healing takes place, the provider will place this tube for at least 3 to 4 weeks. And after that, he will remove the tube. Okay, so this is the procedure done in the silodocoplasty. Here if we see, there is a simple and a complicated. So when to consider it is a simple repair and when to consider it as a complicated procedure? When the diagnosis is not a complicated diagnosis, or else the provider will do the procedure, right? Okay, so it doesn't require lot of time. The procedure will not take lot of time. So in those cases, we can consider it as a simple repair. So when to consider it as a complicated? When the procedure takes a lot of time. So to treat that infection, the provider will do the procedure, right? So the procedure is same thing in both of these. The provider will pass the tube into the duct to treat the infection. Okay, but when to consider it as a complicated? When it takes, the procedure is taking a lot of time, or the diagnosis is a very complicated diagnosis. In those cases, we have to consider it as a complicated repair. And also the operative report will be there, right? They should mention the complexity also. They should mention the complexity also. So here if we see, primary and secondary is there. What is this primary and secondary? Primary is nothing but first time patient is having the infection and provider is doing the repair, normal repair, placing the tube and all that. So when to consider it as a secondary repair? Suppose the infection complexity is very high and it required a secondary opinion. So in those cases, we can consider it as a secondary repair also. So this is the repair of the salivary duct. Now we will see the parotid duct diversion procedures. So 42507 is a parotid duct diversion bilateral, and 42509 is parotid duct diversion with removal of the submandibular glands. See, there is a semicolon. So this is a continuation for this. So if we see this one 42510, this is also continuation for this. Parotid duct diversion bilateral with the ligation of the submandibular ducts. So this CPT code is 42510. So before going into the procedure, why the provider will do this diversion of the parotid duct, now we will see. To treat the sialorrhea conditions, the provider will do the parotid duct diversion. What is sialorrhea? Nothing but the drooling. See, in some patients who are with mental retardation, what will happen to them? The saliva is continuously flowing. Right, see here, if we see, the saliva is flowing, right? So they will have a increase or more production of saliva flowing out of the mouth, right? And also we can see in some Parkinson's disease patients also, or cerebral palsy patients also, we can see the saliva flowing from the mouth. Nothing but the sialorrhea or drooling. It is also called as drooling. So to treat that drooling, the provider, he will do this diversion. After doing the diversion, they will not have the increased production of this saliva. It is treated completely. So first we will see the 42507 parotid duct diversion bilateral. What provider will do in this procedure? See here, where is the parotid duct? In front of the parotid gland. See, this is the parotid gland and this is the parotid duct. So what provider will do this duct? He will divert this duct into the another location. He will place this duct into the another location. So where he will keep that duct into another location? Now we will see. So first, the provider, he will give the general anesthesia to the patient, and after giving the anesthesia, what provider will do? He will identify the parotid duct. Where is the duct? After doing the incision, he will identify the duct and he will dissect out this. He will remove this duct and he will relocate this duct into the anterior tonsillar pillar. See, this is the anterior tonsillar pillar. He will remove this duct and he will divert this duct. He will relocate this duct into the anterior tonsillar pillar. Where is this anterior tonsillar pillar? It is in front of the tonsils. See, this is the tonsil. In front of the tonsil is the anterior tonsillar pillar. So he will divert the parotid duct into this pillar. So by doing this, what will happen? There will be no increased production of the saliva. Nothing but the sialorrhea condition is treated, and this procedure is repeated on both sides of the mouth. See, this is one side of the mouth, right? So they will repeat the same procedure on another side of the mouth. So on both the sides the procedure is performed. That is why if we see here, it is given as a bilateral, and when provider is doing this procedure, no need to append 50 modifier. This is a hint to everyone. So when provider is doing this procedure, no need to append the modifier 50, which indicates that procedure is done on both sides. No need to ascend. Why? Because already the procedure is having the bilateral. Then again, why to append the 50 modifier? No need to append the 50 modifier. So parotid duct diversion bilaterally done. We have to quote the CPT code 42507. Now we will see 42509. This is parotid duct diversion bilateral with excision of the submandibular glands on both the sides. Both submandibular glands are removed. So here if we see in this image, the provider, what he will do in the 42509 procedure, he will identify the duct. Okay, and he will relocate this duct into this anterior pillar. Okay, the diversion is done. And also he will remove the submandibular glands. See, these are the submandibular glands. He will remove, excision is done of the salivary glands. See, the salivary glands are removed in this procedure. So whenever the diversion is done, diversion of what? Parotid duct is done, and also the salivary glands are removed. The salivary glands are removed. So we have to code the CPT code 42509. Okay, diversion plus excision of the submandibular glands, code the CPT code 42509. No need to assign this and this, both, no need. Only one CPT code is enough because it includes this parotid duct diversion plus this excision. Both are done, code only this one CPT code. Okay, now coming to 42510. What provider will do in this procedure? The provider, he will do the diversion of the parotid duct bilaterally. Okay, and he will do the ligation of the submandibular ducts. See here in the image, if we see, he will do the diversion of this duct into the pillar. Okay, but here what provider will do is, this is the submandibular glands, right? So it contains the ducts. Every gland has the ducts. See, these are the ducts. So he will ties it. Ligation is nothing but tying of the ducts. Ligation is what? Tying. So ligation of the ducts. See, these are the salivary ducts. What are these salivary glands? Here they are tying submandibular ducts. So the submandibular ducts are tied. So diversion plus ligation, code the CPT code 42510. Removal of the mandibular plus diversion 42509. So like this we have to assign the CPT codes. Only the diversion ligation is done, we have to code only one CPT code. No need to assign this and this. Only this one CPT code is enough. So this is about the parotid duct diversion procedures. In all these three procedures, no need to append the 50 modifier because it is included the bilateral procedure. So by doing these procedures, the patients who are having drooling, excessive production of the saliva is treated. So now we will see one scenario for our better understanding. Patient is coming with siluria condition. So what provider has performed the parotid duct diversion? Okay, he has done the parotid duct diversion, but in that we have the 3 CPT codes, right? So what procedure the provider is doing now we will see. So he has given the general anesthesia and he has done the incision and he identified the submandibular ducts and he has done the strips of their surrounding tissue using the dissection and he tied the ducts with sutures. What provider has done here? He identified the ducts after incision and he has done the tying of these ducts, nothing but the ligation. And also what provider has done? He has diverted the parotid duct. He dissected out the parotid duct and he relocated into the anterior tonsillar pillar which is in front of the tonsils. So the diversion is done. So provider has done the diversion of the parotid duct plus the ligation of the submandibular ducts. Both he has done. So he repeated the procedures on the both the sides bilateral. Okay, so after the procedure is completed, the provider has removed all the instrument and he packed everything from the operative room. What is the CPT code we have to assign? So we'll see one by one. What is 42507? 42507 is what? It is parotid duct diversion bilateral only. So here in the scenario, what provider has done? He has done the diversion as well. He has done the ligation, right? So this procedure CPT code includes diversion plus ligation? No, right? So this is not the correct option. So we'll see 42509. What is 42509? It is parotid duct diversion bilateral with excision of the glands. In the scenario, did they remove the submandibular glands? No, right? There is no removal of the glands. They have tied it. Tying is nothing but the tying is what? It is ligation. Okay, so they did not remove the salivary glands, right? So this is not the correct option. We'll see 42510. What is 42510? It is the diversion, parotid duct diversion plus ligation. Yes, nothing but the tying of the submandibular ducts. So this is the correct option. They has done the diversion of the parotid duct plus they have tied the submandibular duct in the scenario. If we see the tying of the ducts is done. Here they mentioned submandibular. Yes, it is there. Okay. And then what they have done? They have done the diversion also. So the ligation of the glands is done and the diversion is done. So this is the option. Okay, but here if we see there is a 50 modifier. So this all CPT codes includes the bilaterality. So no need to append the 50 modifier, right? So no need to append 50 modifier. So this is not the correct option. The CPT code is correct, but did I told to append the 50 modifier? See here in the scenario, the procedure is repeated on both the sides, opposite sides. Okay, that is fine. But generally what is 50 modifier? When procedure is done on both sides, we will append the 50 modifier. But the CPT code itself includes the bilateral, right? See here if we see bilateral diversion plus the ligation of both the ducts. No need to append the 50 modifier. So this is not the correct option. Okay, so we'll see option D, which is the same CPT code 42510 with no modifier. So this is the correct option. So the correct option is 42510 with no modifier. So like this we have to assign the CPT code. So we have to also see the modifiers, when to append and when not to append. So this completes the repair procedures on the salivary ducts and the glands. We'll see other procedures in the next session.